Hey there, and welcome. Today, we're diving into the world of anti-seizure medications. These are drugs designed to calm what are, quite literally, electrical storms happening inside the brain. We're going to unpack exactly how they work, who they help, and what it's really like to live with this kind of treatment. So, let's jump right in.
Okay, so here's our game plan for this explainer. First, we'll get a handle on what a seizure actually is, that electrical storm. Then we'll decode the seizure map to see the different types. After that, we'll look at how these drugs work to calm the brain's circuits, check out the specific tools in the anti-seizure toolkit, and finally, we'll talk about the practical, day-to-day side of living with the treatment.
All right, Section 1, an electrical storm. Before we can even talk about the treatment, we've got to get to the root of the problem, that sudden, uncontrolled burst of electricity that starts it all.
So what's really going on inside the brain when a seizure hits? What's happening on a biological level? Well, it all boils down to one thing: electricity. Think of it like a short circuit in the brain's wiring. A seizure is basically an abnormal, out-of-control electrical discharge from the brain's nerve cells, what we call neurons. This sudden surge of activity completely disrupts normal brain function, and that's what causes all the things we typically think of when we hear the word seizure. And look, this is not some rare, obscure condition. In the United States alone, we're talking about 3.4 million people living with active epilepsy, which is a disorder defined by having recurrent seizures. That's a massive number of people whose lives can be totally transformed by effective treatment, which is why understanding these medications is so important. Okay, so moving on to Section 2, decoding the seizure map. Here's the thing. To treat a seizure the right way, you first have to know exactly what kind of seizure you're dealing with. They're not all the same, and they get broken down into two main categories based on where in the brain they get started.
So the main difference, the first big question, is where that electrical storm kicks off. Generalized seizures involve both sides, both hemispheres of the brain, right from the get-go. Partial seizures, on the other hand, start out in just one specific spot. Now, that might sound like a small detail, but trust me, knowing where it starts is absolutely crucial for picking the right medication.
And even within those big categories, things get more specific. You've probably heard the old term grand mal seizure, right? Well, today that's called a tonic-clonic seizure, and that's the one that involves muscle contraction and jerking. Then there's what used to be called a petit mal seizure, now known as an absent seizure. This one is really common in kids and can just look like they're zoning out for a few seconds.
Okay, so if a seizure is basically an electrical overload, then the big question is, how do you calm all that activity down? That brings us right to our third section, calming the circuits. Let's see how these medications actually get the job done.
This is where the drugs get really clever. They basically have three main strategies. First, they can suppress the flow of sodium into nerve cells, which is kind of like slamming on the brakes to keep them from firing too fast. Second, they can block calcium, which is like cutting the wire so that electrical signal can't jump to the next cell. And third, they can boost the action of something called GABA, which is the brain's very own natural calm-down signal.
So, keeping those three actions in mind, let's open up what we're calling the anti-seizure toolkit and see which drugs do what.
First up, we've got a classic, the hydantoins, and phenytoin is the most famous one in this group. This one was discovered all the way back in 1938, and its main job is to do that first thing we talked about. It suppresses the flow of sodium, which helps stabilize the nerve cells so they can't fire out of control.
So phenytoin is your go-to for tonic-clonic and partial seizures. But here's the catch, and this is super important. It has what's called a narrow therapeutic range. That means there's a razor-thin line between a dose that works and a dose that's toxic. The level in the blood has to stay right in that sweet spot between 10 and 20 micrograms per milliliter. That's why anyone taking it needs constant, careful monitoring.
All right, next up in our toolkit are the succinimides, like a drug called ethosuximide. Remember that second mechanism we mentioned, the one about calcium? Well, that's exactly what this class of drugs does. It works by decreasing calcium flow, hitting a whole different target to get the brain's circuits to calm down.
And this right here is a perfect example of why you need a whole toolkit, not just one tool. While phenytoin is used for those tonic-clonic seizures, ethosuximide is the drug of choice for absent seizures. It just goes to show you can't treat all seizures the same way. You need different drugs hitting different targets in the brain.
But what happens in a real emergency? Well, for something called status epilepticus, which is basically a seizure that won't stop, doctors reach for the benzodiazepines, drugs like diazepam and lorazepam.
and their job is to crank up the volume on GABA, the brain's natural off switch, to stop a seizure fast.
Okay, so let's put it all together. Think of this as a quick reference map. So you've got your hydantoins for tonic-clonic and partial seizures, your succinamides for absent seizures. But wait, check this out. Valproic acid shows up for both. That's because it's kind of like a Swiss Army knife. It can work on multiple pathways, making it useful for different kinds of seizures. And of course, for emergencies, it's the benzodiazepines.
Okay, we've talked a lot about the science, the cells, the chemicals. Let's switch gears and talk about the person taking the medication. This final section is all about what it's like living with the treatment day to day.
Pregnancy, as you can imagine, adds a whole new layer of complexity. It's a real balancing act. Seizures can actually happen more often, but at the same time, some of the medications can pose risks to the developing fetus. Supplements like vitamin K and folate can help, but the bottom line is this is something that has to be managed super closely with a doctor. It's absolutely non-negotiable.
Taking these meds long-term also means you have to be your own best advocate, and that starts with knowing what to look out for. Things like a sore throat or bruising easily, you gotta report that, because it could be a sign of blood issues. A rash is another big one. It can be the first sign of a serious reaction. And then there's this really specific one, especially with phenytoin, called gingival hyperplasia. Basically, your gums can get swollen and overgrown, which means you have to be really on top of your dental hygiene.
And that brings us to some hard and fast rules for daily life. A practical checklist, if you will. Number 1, and this is the big one, never, ever stop the medication suddenly. That can cause major rebound seizures. Also, you gotta stay away from alcohol and other things that depress the central nervous system. Taking the meds with food can help with stomach upset, and because some of these drugs can interfere with birth control, using a backup method is really important. And finally, wearing a medical alert ID is just always a smart move.
So after all that, all the side effects, the monitoring, the rules, you might be wondering, do these drugs even work? Well, the answer is a resounding yes. The results are, frankly, pretty amazing. For about 70% of patients, seizures are controlled, completely controlled, for 7 out of 10 people. That's not just a statistic, that is life-changing. But, and this is a really important but, we have to be clear about what these drugs do and what they don't do. There's a great quote from our source material that says it perfectly. These drugs prevent seizures but do not eliminate the cause or provide a cure. They are an incredible management tool, not a cure.
And that really brings us full circle. I mean, it's an incredible achievement of modern medicine that 7 out of 10 people can find relief and live seizure-free. So the question that keeps scientists and doctors up at night is this: what's the next frontier? What new tools can we develop for that other 30% whose seizures aren't controlled by the toolkit we have today? Thank you for joining us.